Good morning, students. Myself, Dr. Abhishek Raj from Department of Pharmacology. Let's continue our lecture on Class 3 Antiarrhythmic drugs. Class 3 antiarrhythmic drugs are potassium channel blockers. Examples include Bettiah, ibugilide, doftilide, amiodarone, dronedarone, sotalol, and vanacarate. In this slide, we'll see the effect of class 3 antiarrhythmic drug, that is potassium channel blockers, on ventricular action potential. So during normal ventricular action potential, the outward movement of potassium, that is the efflux of potassium, is responsible for a repolarization phase, that is phase 3. So here you can see the outward movement of potassium is responsible for this repolarization of phase 3, this repolarization or phase 3 due to potassium efflux, outward movement of potassium. So if we give class 3 antiarrhythmic drugs, that is potassium channel blocker, that will block the potassium channels. As a result, repolarization will be slow. So the graph takes longer time to reach to resting movement potential. So the graph, now this is the graph. Now this is the graph, and this is repolarization, that is slow. As a result, action potential duration will be prolonged. This from here till here will be the action potential duration, that will be prolonged. So it will lead to, that means effective refractive period will be prolonged. That means QT interval on ECG will be more, and that increases the risk of Torsatz D points. So this is the effect of class 3 antiarrhythmic drug on repolarization phase in ventricular action potential graph. Of class 3 antiarrhythmic drug, that is potassium channel blocker, they have the property of reverse use dependence. This is very important. Class 3 antiarrhythmic drug or potassium channel blocker has the property of reverse use dependence. What do you mean by reverse use dependence? In simplified language, we can say that if there is an increase in heart rate, that will result in decreased effect of drug. So class 3 antiarrhythmic or potassium channel blocker are more effective at low heart rate. That means if arrhythmia has developed, these drugs are less effective. Again, there is a property of use dependence. The property of use dependence. So what do you mean by use dependence? Increase in heart rate, that means increased effect of drug. And use dependence is the property of class 1 antiarrhythmic drug, that is sodium channel blocker. So class 3 antiarrhythmic drug or potassium channel blocker has the property of reverse use dependence. And what do you mean by reverse use dependence? When there is an increase in heart rate, there is decrease in the effect of the drug. This property is characteristically shown by class 3 antiarrhythmic drug or potassium channel blocker. They are more effective at low heart rate, and if arrhythmia has developed, they are less effective. In class 3 antiarrhythmic drugs, that is potassium channel blockers, the first example which we are going to study about is amiodarone. First, we will study about the uses of amiodarone. What are the uses of amiodarone? Atrial fibrillation and atrial flutter. So, the first indication of amiodarone is atrial fibrillation and atrial flutter rhythm control. Now, rhythm control means to convert atrial fibrillation back to sinus rhythm, and for rhythm control, amiodarone is drug of choice. Now, for rate control, beta blockers are drug of choice. Now, acute attack of atrial fibrillation and atrial flutter cardioversion is treatment of choice. What is cardioversion? It is a medical procedure by which arrhythmia is converted to normal rhythm using electric shocks. Now, if cardioversion is not effective, then we will give ibutolide intravenous is drug of choice for acute attack of atrial fibrillation flutter. Then we will repeat cardioversion. So, atrial fibrillation and atrial flutter, for rhythm control, amiodarone is drug of choice. For rate control, beta blockers are drug of choice. And for acute attack of atrial fibrillation, atrial flutter, cardioversion is treatment of choice. If it is not effective, then ibutolide intravenous is drug of choice, and then repeat cardioversion. Now, other indication of amiodarone. Amiodarone is drug of choice for refractory ventricular tachycardia. For refractory ventricular tachycardia, amiodarone is drug of choice. For ventricular tachycardia, drug of choice is lidocaine. But if ventricular tachycardia is refractory, then amiodarone is drug of choice. Now we will study some features of amiodarone. So, amiodarone is broad spectrum antiarrhythmic drug. Amiodarone is broad spectrum antiarrhythmic drug. That means it has all four action. It has all four action. It is class 3 antiarrhythmic drug, that is potassium channel blocker. And this class 3 antiarrhythmic drug has properties of class 1, class 2 and class 4. Class 1 means sodium channel blocking activity, class 2 beta blocking property, and class 4 calcium channel blocking property. So it has all four action. So it is broad spectrum antiarrhythmic drug, that is amiodarone. In case of amiodarone, there is absence of reverse use dependence. Due to this reason, it is broad spectrum antiarrhythmic drug and there is absence of reverse use dependence property. Risk of torsades, D points is least. Even QT interval is prolonged by amiodarone. So what we have studied about this drug amiodarone? Some features we have studied. First thing we have studied, it is broad spectrum antiarrhythmic drug. It means it has all four action. Class 3, that is potassium channel blocking. Class 1, class 2 and class 4. It also, the property of reverse use dependence is absent in case of amiodarone. So risk of torsades, D points is least in case of amiodarone. Since it is broad spectrum antiarrhythmic drug and even the QT interval is prolonged by amiodarone. But the risk of torsades, D points is least in case of amiodarone. Amiodarone, some more features about amiodarone. Amiodarone is lipophilic, means it has high lipid solubility. So apparent volume of distribution is more in case of amiodarone. So amiodarone gets deposited throughout the body. Amiodarone gets deposited throughout the body. So it has long half-life, that is 3 to 8 weeks. So half-life of amiodarone is 3 to 8 weeks. Since the half-life is long, it is longest acting antiarrhythmic drug can say it is the longest acting antiarrhythmic drug. You can also say it is longest acting potassium channel blocker. Since the half-life is long, that is 3 to 8 weeks, it is given as loading dose. It is given as loading dose, that is 800 to 1600, 800 to 1600 milligram per day. For a few weeks. Followed by maintenance dose. Some features of amiodarone: it is lipophilic, that is it is having high lipid solubility, so apparent volume of distribution is more, so it will get deposited throughout the body. That will be the reason for its long half-life, that is 3 to 8 weeks. So this drug amiodarone is longest acting potassium channel blocker and is longest acting antiarrhythmic drug. Since it has long half-life, that is 3 to 8 weeks, it is given as loading dose, that is 800 to 1600 milligram per day for few weeks, followed by maintenance dose. Amiodarone is metabolized by CYP3A4 in liver. To desmethyl amiodarone. It is a metabolite of amiodarone. So amiodarone is metabolized by CYP3A4 in liver to desmethyl amiodarone. And gets excreted in bile. Amiodarone contains high level of iodine. And this iodine synthesize thyroid hormone. So can cause hyperthyroidism, that is rare. And this hyperthyroidism is seen in iodine deficiency region. So amiodarone on long term use, what will happen? There will be suppression of thyroid function. So it will inhibit deiodinase enzyme in systemic circulation. So it will inhibit the enzyme deiodinase in systemic circulation. So what will get inhibited? Conversion of T4 to T3 systemic circulation will get inhibited, and that will cause hypothyroidism. And this hypothyroidism is seen in euthyroid region, which is most common. Hypothyroidism is most common. This is the effect of amiodarone on thyroid function. So amiodarone causes side effect, that is hyperthyroidism, which is rare and is seen in iodine deficiency region. And it also causes side effect hypothyroidism in euthyroid region, and this is most common. What is the mechanism? Because since amiodarone contains high level of iodine, so this iodine is helpful in synthesis of thyroid hormones, and that causes hyperthyroidism, but it is rare. And amiodarone on long-term use causes suppression of thyroid function. That suppression of thyroid function results in inhibition of deiodinase enzyme in systemic circulation, and this deiodinase enzyme is responsible for conversion of T4 to T3 in systemic circulation. So this conversion will be inhibited, and that will result in causing hypothyroidism, which is most common thyroid side effect seen with amiodarone. Now we will study about side effects of amiodarone. Side effects of amiodarone. First is thyroid side effect. Hypothyroidism is most common, or it can cause hyperthyroidism. Other side effect of amiodarone: peripheral neuropathy. On heart, it causes myocardial depression, and it can also cause hypotension. On lungs, it causes lung fibrosis. Liver toxicity is the other side effect of amiodarone. On eyes, it causes corneal microdeposits. This corneal microdeposits is reversible on discontinuation of drug. This side effect, that is corneal microdeposits, it is reversible on discontinuation of drug. Next side effect is photosensitivity. So it causes blue discoloration of skin. It causes blue discoloration of skin, and that is also reversible on discontinuation of drug, and also reversible on discontinuation of drug. So long-term therapy of amiodarone, when we give amiodarone for long term, we regularly check liver function test, thyroid function test, and pulmonary function test. These are side effects of amiodarone: hypothyroidism. Hypothyroidism is most common thyroid side effect. Peripheral neuropathy, myocardial depression or myocardial depression, hypotension, lung fibrosis, liver toxicity, corneal microdeposits, photosensitivity that lead to bluish discoloration of skin, and these side effects like corneal microdeposits and blue discoloration of skin are reversible on discontinuation of drug. We will study about other anti-arrhythmic drugs in the next lecture. Thank you.